The Association of Surgeons in Uganda has concluded its 3-day conference in Kampala, which focused on discussing the sector's achievements, challenges, and the way forward, with particular emphasis on new developments in the field. Speaking to journalists during the conference's closure, Moses Garukande, president of the Association of Surgeons of Uganda, announced that they have agreed to develop a framework plan called the National Surgical Obstetric and Anesthesia Plan. This plan will be a national health initiative specifically aimed at improving surgical capacity and access in the country, an area that has traditionally been overlooked in most national health plans. The goal is to prioritize surgical services within the national health agenda.
In a big meeting called the World Health Assembly, some countries decided, a resolution was made that surgery, the cause of surgery should be elevated, should be brought to the fore. And to do that, there was a suggestion that a framework is developed called the National Surgical Obstetrics and Anesthesia Plan. So one of the resolutions from this meeting was the Permanent Secretary has invited us to present that plan to the Minister of Health in 4 weeks. When we present this plan, the content of that plan will be agreed by the senior management of the Ministry of Health and incorporated in the National Development Plan.
Dr. Garukande added that the conference resolved to strengthen efforts to address the growing problem of antibiotic misuse, which is leading to negative consequences.
Globally, it is in hundreds of millions of people dying when they shouldn't have died if the antibiotics were still effective. In one of the studies that has been shared here, up to 2 patients out of 10, the antibiotics were not working.
Emphasized that antibiotic misuse has become a significant issue in the country, and there is a need to reinforce structures across various institutions, including through education and awareness.
For inappropriate use of antibiotics, which is becoming a very, very big problem in our country. Inappropriate use of antibiotics. So the call is to strengthen the different structures in the different institutions, both from teaching it and practicing it, so that we minimize or avert the challenges of misuse of antibiotics.
Further explained that the misuse of antibiotics results in the development of resistance in the organs being treated, and the ultimate consequence of this resistance is death.
You misuse antibiotics, the organisms you're treating become resistant to them, so the antibiotics becomes ineffective. So when the next person needs them and uses them, they won't work, and the ultimate consequence is dying. You have a problem that otherwise could be solved by an antibiotic, but because it has been misused, the organisms have developed resistance, you use it again and it's ineffective, and there's nowhere to run.
Brian Kavuya, Managing Director of East African Medical Vitals, a company that manufactures surgical gloves and is a partner of the Association of Surgeons, stated that they plan to embark on research to gain insights into the challenges surgeons face in the operating room. The goal is to better understand the needs of surgeons in order to determine which products to diversify and improve existing ones.
We are soon to embark on some research we've just talked about with the association to give us more insight into what surgeons go through in the operating room and outside of it, and see how we can maybe understand which products we can diversify into and how we can also improve our product.
Dr. Jacob Nsubuga from Mulago Referral Hospital expressed that despite having many skilled medical experts and making a significant strides in health care, there is still a shortage of adequate medical equipment. This lack of resources has unfortunately led to some patients losing their lives.
We have doctors really, they are doing really great work. All hospitals in the country, surgeons are doing really great work, but there is that aspect of seeing a patient as a whole. I think this is something that has been neglected by some people. When you have these patients, some of them come really, the government is willing to support. But unfortunately, some of these implants are expensive. Because some of these implants are expensive, patients have to buy them at subsidized fee from accepted people who settle them in the hospital. So these patients end up staying for more than a month.
Dr. Todo Tato, cancer expert from Minnesota University, raised the issue of patients seeking diagnosis too late, despite Uganda having skilled medical experts.
I had a chance to visit the Uganda Cancer Institute and talk with your oncologists and surgeons, and I think that Uganda has some very good physicians. I think Uganda has very good treatments. The problem is that patients are coming in way too late. The cancer is much too advanced. It's already spread.
Julius Mhumuza, Church of Uganda Family TV, News at 8.